Among DOGE's targets when it comes to cutting down government waste is Medicaid. For months now, headlines have been sweeping the nation of possible cuts to the program and how much money the Trump administration says has been wasted on Medicaid and other government aid fraud. Tonight, I'm digging into the future of the program and how changes to it could affect you. President Donald Trump and members of Congress are weighing cuts to one of the largest U.S. safety net programs. Medicaid cost Washington $618 billion last year and is projected by the Congressional Budget Office to grow 60% over the coming 10 years, according to Reuters. The Department of Government Efficiency has been working at the Centers for Medicare and Medicaid Services trying to uncover government waste. Meanwhile, lawmakers are divided over the potential cuts. President Trump assuring the nation in February fraud is what his administration is after.
Social Security won't be touched. Other than if there's fraud or something, we're going to find it's going to be strengthened, but won't be touched. Medicare, Medicaid.
Pennsylvania Attorney General Dave Sunday's Medicaid fraud control section ranks #1 nationally in fraud charges filed in the program. During the 2024 fiscal year, the section recovered more than $11.3 million in misused Medicaid funding. But some who work in health access are worried about where the conversations surrounding Medicaid and fraud at the national level are headed. Dana Casserly is the co-executive director of the Pennsylvania Health Law Project, a statewide nonprofit that helps people access Medicaid and provides legal services for their care. Casserly says 3 million people in the Commonwealth rely on the program. 42% of them are children, 5 in 8 Pennsylvania nursing home residents are covered by it, and 1 in 4 Medicaid recipients have a disability.
We know that most people on Medicaid, especially Medicaid expansion, are already working, and if not, they're disabled, they're a caregiver.
Some lawmakers in D.C. remain adamant the federal government can find a way to keep individuals entitled to the program on it while saving money.
I think we ought to focus on 3 things. 1, taking all the illegals off. Everybody should be in favor of that. 2nd, we should reduce from 12 to 6 months how often you have to go re-register and get your qualification checks. And then 3rd, we should require work for able-bodied adults. You do those 3 things, you save about $370 billion over 10 years, and there's a lot of consensus around those 3 provisions.
But Casserly says even if the federal government is only looking to root out waste, fraud, and abuse, efforts to do that will impact care for those who need it and qualify for it.
All those folks are going to get caught up in the red tape to actually show either that they work or they qualify for an exemption. And when that happens, really what we're talking about is just people getting thrown off the rolls.
Casserly adds that if the federal government is looking to save $880 billion, just finding fraud isn't going to cut it.
That is where a lot of the sort of rhetoric goes, that there must be all these people out there, benefiting from a program that they simply don't qualify for. And I can tell you just from working with, our clients that we see at the Health Law Project across the state of Pennsylvania, they're having trouble accessing these benefits in the first place. The idea that somebody would be, sort of smooth sailing on Medicaid when they don't meet the criteria is really unfounded.
She says potential changes to the program would impact not just those who are on it, but everyone. With more Americans who are uninsured, she says the costs of their health care go up. No health care coverage often leads to more trips to the emergency room that hospitals have to pay out of pocket to cover. Hospitals then raise costs to account for that. Casserly says there are also consequences specific to NEPA. Healthcare is the largest employment sector in the Commonwealth, accounting for 21% of employment in Northeast PA. Direct care workers, home health aides, and nurses, all people whose paychecks are supported by Medicaid dollars. And if cuts are made to Medicaid, their paychecks are at risk.
Things are changing every day. Right now, things are very much up in the air. We don't know where things will go. What advocates and lawmakers here are trying to do right now is prepare for, what is going to be the fallout if this goes through.
Casserly says a lot of what comes next for the Commonwealth depends on what happens at the federal level through the current congressional budget reconciliation process.